Hello and welcome to New Start at Home. I'm Don McIntosh. We're glad you're with us, and we're glad today to have Dr. David DeRose with us in the studio. Dr. DeRose is a specialist in internal medicine and also, I believe, Dr. Preventive medicine. In other words,
exactly right.
How to prevent problems, and then if they have problems, how to help them if they do.
No, you're right. Preventive medicine actually looks at the whole scope of prevention, what we sometimes call primary prevention, preventing diseases from ever occurring. And then there's other aspects of prevention that try to prevent the ravages of various diseases.
And one of the things that can prevent disease is a robust or healthy immune system. That's what we're going to talk about today.
Very important. Immune system is incredibly important. Whether we're speaking about cancer or the garden variety cold, our immune system has a whole lot to say about whether we're going to come down with some of these illnesses.
So you, I think, have some new research you want to share with us, but the immune system, what can we do to enhance it?
Well, there's a lot of things we can do to enhance the immune system, and we really don't have time to give an exhaustive list, but moderate exercise is very important, healthy diet, stress management. We want to focus today, though, on adequate rest.
Adequate rest as it relates to the immune system. How much do we need? I'm in my 40s, let's just say, late 30s, and how much rest do I need?
Well, I mean, this was the real shocker. A study fairly recently published in 2009 actually looked at this question as it related to the common cold. One of the viruses that cause the common cold is called the rhinovirus.
Rhinovirus.
Yeah, no relation to the African wild animal.
Okay, good.
Rhino actually, refers to the
Just a much smaller rhino.
Yeah,
Yes.
you got the general idea. So the rhinovirus is one of these viruses that cause the common cold. And researchers in this particular study gathered a group of some 150 individuals and studied their sleeping habits for 2 weeks. They actually took careful logs of their sleep habits. They questioned them after sleeping, and they were able to generate some charts for each individual showing how many total hours they slept and the quality of their sleep. In other words, how much time specifically they were sleeping while they were in bed. What they then did is they inoculated each of these individuals with the rhinovirus.
So they gave them the cold.
Well, they gave them the virus.
Right.
The interesting thing was not all of them developed an infection, and even those that developed an infection, not all of them came down with a cold. Now, some of our viewers may be a little bit perplexed as to how you can get an infection and not have a cold.
You fight it off.
Exactly. We know as health professionals that it's very common to have what we call an inapparent infection. So a person can have the disease, you can check their blood, the blood says, yes, the immune system has geared up, you actually have influenza or rhinovirus or whatever, but you look and feel healthy. So, some individuals in that scenario. But when you looked at the people with the clear-cut colds, triple the risk of having a cold if you were getting less than 7 hours of sleep per night compared to more than 8.
So between 7 and 8 is the magic number. Was that for every age?
No, it was not the magic number, actually. Between 7 and 8 was intermediate. 8 hours or more were the best.
What do you mean more? Can I 12 hours? Is that good? 15 hours?
There is a point of diminishing return. In the particular study, they found that those who were getting more sleep than 8 hours actually had better immune systems based on how they handled the rhinovirus than those who were even getting the typically recommended 7 or 8 hours of sleep a night.
So if you're feeling sick or maybe you're in a situation, you should probably get more sleep when that's happening.
Excellent. That's the bottom line message. If you're feeling tired, that's a sign your body may be trying to fight something off. You may need that extra immune reserve, and don't hesitate to try to, even if you got to get a nap in or go to bed earlier, do what you need to do because sleep is something very important for your immune system.
So the diminishing return came when? 12 hours, 10 hours, 15 hours?
Well, the researchers in this particular study didn't look at it, but we know from other research that too much sleep is not desirable either. What the question is when you look at population groups, are people sleeping more because they're unhealthy to begin with? That's, the chicken or the egg question that always comes when you look at sleep habits.
We've been talking to Dr. David DeRose. We've been talking about sleep and rest as it relates to the immune system. And we learned today that the typical 7 or 8 hours that we normally talk about is really not enough when you're feeling tired or sick. You need to bump it up a little bit over that 8, maybe 8 or 9 or maybe even 10. and the body will kind of tell you. If you want more information about this, go to newstart.com, and we thank Dr. DeRose for being with us, and we thank you for being with us today. Have a great day.